The condition I want to talk about today is acute reactive arthritis. Acute reactive arthritis is similar to another type of arthritis called infectious arthritis. The only difference is that reactive arthritis is not infectious. It can be caused or accompanied by various different types of other conditions such as GI infections or even urinary tract infections. One of the most common ones, according to research, is chlamydia infections. And what happens is that bacteria is able to travel throughout the body and make its way to a joint, causing or sometimes being a cause or root cause of acute reactive arthritis. Some of the symptoms that can be presented with acute reactive arthritis is a red hot swollen joint. The unfortunate part is that the pain can range from very mild to very severe to the point of actually being bedridden. Due to the swelling and pain, knee bending movements and any type of weight bearing can be a limited or can cause limitations depending on how severe the condition is. So if they are not as severe, pretty mild, I'm sure weight bearing isn't as bad. But when it's super severe, then sometimes they might not even be able to add pressure onto it because of how tight or how painful that joint can feel due to the inflammation. So one of the activity limitations could be walking up and down stairs, whether that be at home if they live in a two-story house, or if they need to go to different locations that require going up and down the stairs and they do not have an elevator type of transportation. So the first video I'm going to show is how someone would normally walk without that activity limitation. So as you can see from the video, there was no type of limitation when it came to walking up and down the stairs for somebody without this type of condition. The next video I'm about to play is a type of modification or alteration that you can do when walking up the stairs with somebody who has acute reactive arthritis. You'll notice in the video that as you walk up the stairs, you can rely on one leg more than the other, whichever is not as inflamed, and use the handrails as a type of support to be able to bear some weight with your upper extremity. The last video I'm about to play is for somebody with acute reactive arthritis and walking down the stairs. Now the example that I'm gonna show is good if there's safety rails, so that way they can hold on to it in case they're about to fall, or if they have somebody with them who can help them down the stairs. But my thinking with this was that as they're walking down the stairs, they can walk backwards to transfer where the weight is gonna be bared. So for example, when they're walking forward, a lot of the weight bearing gets translated onto the knees. But if they walk backwards, the weight or the center of gravity shifts backwards to be a little more on the hamstrings and the glutes, taking majority of that weight bearing movement. With that being said, they can also use their arms to transfer some of that weight onto the hand railing, so that way they're not putting too much pressure on their knees if they still feel pain from transferring it over backwards and relying on the less affected side than the side that has a lot more inflammation. So in addition to activity limitation alternatives, another thing a patient can do to combat acute reactive arthritis is treatments such as taking medications such as NSAIDs and antibiotics to try and get rid of the bacteria and to reduce the inflammation, so that way weight bearing and knee bending types of motions is possible until the joint fully heals. So thank you.